Hey everyone, it's Dr. Becky, Dementia Disruptor, with tips, tricks, and potentially painful truths about dementia. So I had somebody specifically ask about the medications that can cause issues for our loved ones who are living with Lewy body dementia. Now, I haven't talked about Lou specifically. Haven't talked about anybody specifically yet because we had other fish to fry, so to speak. So more on Lou to come. And I call him by his name. I just call him Lou because Lou and I are friends, and I know what kind of a jerk he can be. Jerk's the best word I've got. I usually call him a word that starts with A and ends with hole because he is. He is, and you're allowed to steal that and call him an a-hole too because he is. So anyway, getting back to the meds. Remember, I am not a medical doctor, so please don't say Dr. Becky says and, let people think that I'm a medical doctor. I'm not. So I'm taking this directly from the Lewy Body Dementia Association. Feel free to check out their site. They've got a lot of great information there. But really, it comes down to antipsychotic medications. So one of the hallmarks of Lewy body is hallucinations and delusions, and they're prevalent. They are realistic for them, and they are usually very elaborate. I'm really impressed with their hallucinations. They're pretty good. But say you go to the ER because they're being upset, or even you just go to your doctor saying, oh my gosh, we have these hallucinations and it's causing these behaviors because of these hallucinations. And they say, hey, let's do some Haldol. Let's do some Mellaril. These are traditional antipsychotics that we, meaning the collective community, not me, but medical doctors will use to help just curb that behavior, to help kind of it down. But for Lewy body, it makes it worse. It causes more distress. It causes more movement issues, which now can cause falls. It can just kind of rile them up a little bit inside. And we don't want that. We don't want that. So I've had families with loved ones with Lewy body who just put on their medical chart that they're allergic to Haldol, they're allergic to Mellaril. They just put each of those traditional antipsychotics, and they put them as an allergy. Sometimes a doctor will question if there's an allergy, and you can just say it causes these behaviors. And if they say, oh, well, it's an adverse effect. Well, it's not your adverse effect, is it now? It's mine, and I have to deal with it, so let's not adverse anything. Right. So things to think about. Traditional antipsychotics. Those are just two of the ones that they might be prescribing for you and for your loved one, really. Maybe you. I don't know. Anyway, but just make sure your folks are educated. Let them know that this is not going to be the best plan for our loved one. Okay? Okie dokie, friends. Do all the things like share, follow, check out the new website, dementiadisruptor.com. Not all the way together, so don't freak out when you click on something and nothing's there. It's coming. Be patient. It's all going to come. All right? Have a great day, friends.